Hello, listeners. Welcome to Views on Health. And as yet another Monday evening comes by, it's a great pleasure to have with me on the program tonight Dr. Asanka Miguelhewa, consultant in emergency medicine at the Accident and Emergency Department, Teaching Hospital in Karapiti, Galle, down south in Sri Lanka. And I'm sure listeners will recall that we had Dr. Asanka Miguelhewa speak to us last week on dealing with accident and emergency care at the Karapiti Hospital and the services that are provided across the country in this particular area of medicine, that is treating emergencies irrespective of what the ailment is. Tonight on the program, the focus is on road traffic accidents and the trauma that people go through as a result. Without any further ado, may I request you, Doctor, to please tell our listeners about the situation, or rather an overview of road traffic accidents and the trauma that you have come across in your practice.
Thank you, Fatima, getting me down again. So now, to start with, now we, as a disease entities, like we are really worried about the heart attacks, stroke, and maybe this diabetes mellitus causing so many problems. But have we ever thought of the road traffic accident and how many deaths happening worldwide and how many deaths happening in Sri Lanka, for that matter? So if you go with the stats, and that's number one killer as an entity in worldwide and in Sri Lanka, which we have never thought of, right? So why I'm emphasizing this fact? So there are so many things that we could do to prevent this, and there are so many things we can do if we get this badly injured patient to our hospital. So what I see in Karapiti, this is my experience, which I'd like to take a note for you all. I see about 10, 15 badly injured road traffic accidents. And unfortunately, some of these victims are kind of quite preventable. Like simple thing, like I've seen people driving after taking alcohol, so which can be preventable. And I've seen so many motorbike riders without wearing helmet riding and clashing with the vehicle and then crushing their head down. So all these are preventable causes which we should again think as a national, as a person to prevent this. So it's a responsibility of all to prevent this, right? But I'm not going to touch more on that topic, but let me tell what we do if we get this badly injured patient to a hospital. So again, now this patient could be dying or could be badly injured, and there will be multiple organs involved, like it may be heart, it may be your brain, it may be your leg. So most of these major trauma, it's not one entity, it's like multiple system and entity injured in trauma. So how we deal with this, we go as a protocol. So where we treat the most important thing first. So it's called, in our medical, and it's called ABCDE approach. So where you look for any problem in your airway, that's your windpipe, and then you check whether there's any problem of your lungs. So that's the breathing, B. And then you check whether there's any problem in your circulation, that's your heart and your blood vessels and blood. And then you check the D is the disability, where you check the mentation, whether there's any problem with your brain. And then once you had seek any problem of these entity, and then finally you fully expose this patient to see whether we have missed anything. So that's the usual standard of care we give in our setup, and that's the standard in worldwide also. And most of these victims, they die off because of bleeding. So it may be a bleeding outside, so which is external bleeding, and commonly bleeding inside, like crushed liver, crushed heart. So those are the common reason for these sort of deaths in road traffic accidents. So that's a briefing.
Doctor, if you will bear with me, I'd
Yes.
like to go back to what you said that these can be they're preventable.
Yes.
You didn't want to delve much into that, but I would like to sort of draw attention to our listeners, to our audience right now, that what you very correctly said, that a person who's after driving after alcohol intake or excessive alcohol, it's not just a drink or two, but obviously not in a mentally stable condition, or maybe even physically not stable, because your alcohol levels are that high
Yeah.
that you're not steady on your feet. You may stagger to your car, and you get into the car, you think now you can make it home or wherever you're going, and you don't. So that is totally preventable. So the responsibility is on each one of us. Now, motorcycle riders without helmets, by and large, they are wearing, but I suppose there are the odd miscreants who don't do it. And then obviously when they meet with an accident, because they do ride rather recklessly. That's something we see all over Sri Lanka, unfortunately, that they weave through the traffic, and they have absolutely no patience to wait even at during traffic lights. They are just revving to take off like they are going to do a racing to a point. So in the process, they cause injuries to themselves as well as others they meet with. It's not just one person involved.
Yeah.
In where to be more than one person is involved. So this sense of responsibility or irresponsibility, may I put it that way, that is displayed by some of the Sri Lankans, is something that needs to be addressed. And it's not your job, it's not my job. Well, in the same, we create the awareness as media, but the onus is on each person to follow the rules and not do things that they shouldn't do, because they create a huge issue, not for themselves only, but to their families, to the medical team. You don't have to do anything if they don't come with an injury, but they come through their own irresponsible actions. So I needed to bring that into focus, doctor. Thank you for bearing with me. So you have this situation of road traffic accident that you're dealing with, which I think is pretty bad in Sri Lanka. We have on an average, I think, 8 accidents a day, if I'm not mistaken. Please correct me if I'm wrong. Could you comment on that aspect?
So you mean 8 accidents per day?
Across the country?
It's much more than that.
How many would it
It's
be?
it's about now I have done my statistics in Gaul region. It's about the major accident in the Gaul region, in southern region, it's about 15 to 30.
I'm sorry, I see it corrected.
Yeah.
It's about, I meant 8 deaths a day.
Yes.
Through
that's
because
correct,
of the accidents,
Yes.
not the accidents per se. Deaths, yes. Continue, doctor.
Yeah. So so I totally agree now your points. That's why I want to highlight this prevention. But I mean, you can drive fast, but at the end of the day, you would be saving only 3-4 minutes. So why would you take risk and take all these risks and do it? And it's not like a really bad patient who's having weak organs. No, these are young young people dying because of the road traffic. So it's totally unfortunate to see these events happening. And so, as an emergency medicine, what we do, we take care of these victims, badly injured patients, in a well-organized manner in our departments. As I mentioned in earlier sessions, now it's in almost all the teaching hospitals it's happening. And also, we have combined this emergency medicine with the pre-hospital setting, so to keep the chain going. So as I mentioned, now if you don't do the things from the beginning, the outcome will be poor. So once you get a bad accident, these people should come to a hospital at the earliest. So that's why the pre-hospital service 1990 Suvasariya will take place. So if you see, now I'm telling all the listeners, if you see an accident and if you see someone is injured, just call 1990 and let them know. And we will be going there and get the patient to our hospital And once we get this patient in the hospital, we will be doing the full uh, medical care, providing full medical care to get the patient back as a normal individual as much as possible. So I think that's one thing I would like to highlight. Use 1990 for a good effect. Don't, again, I'm emphasizing, don't use 1990 for a simple matter.
Doctor, the question that I think audience would like to know,
Yes.
the answer rather to it is that the 1990 medical care providers who come in the ambulance are trained to deal with the emergency on the spot and then transfer the patient to the hospital.
Yeah, I mean, so it's a long story, but if you make it short, so in other countries they have these pre-hospital service. Most of the service is called paramedic service, where all these the people will be well trained and knowledgeable to treat then and there. And some of the hospital they provide this care with a doctor in, so doctor and a paramedic. But in Sri Lanka, now again, as I mentioned, the emergency medicine itself is a brand new specialty. And with this brand new specialty, to start a pre-hospital service at this level, again, that's a quite achievement. So at this stage, what we have is the professionals called EMTs, so emergency medical technicians, which they can do something, but not the hi-fi stuff. So they can give a cardiorespiratory, they can give a chest compression, they can give some oxygen, some can put a cannula and give some saline, but not at the full extent. But as I mentioned, now we are planning to develop this as a well-established entity in the future. It will take some time, but again, but the most important thing again, now they'll be given the optimum care that they could provide. But if they can bring with that treatment to our hospital immediately, then we can take and we can give the full best, like the best of care as in developed countries, which we can provide at this stage in our hospitals with our emergency doctors on board.
Doctor, could you elaborate more on the 1990 service that is provided island-wide?
Yeah, I mean, so we have about 800 plus ambulances. And then we have about 200 plus ambulances, and we have 800 plus EMTs, and we have the pilot. Pilot is the one who drives the ambulance, but this is different as in government hospital ambulance, where the driver in 190 also is trained of giving some sort of medical treatment. So when they go to a bad scene, bad victim, they both will be treating this patient. Right? So altogether, we have staff about 1,400. And we, as the emergency medicine consultant and emergency medicine team, provide the training in conjunction with the health ministry. And so we do quite a lot of training program for them. And the 2019 we conducted training program with the collaboration of Australian College of Emergency Medicine and Australian College of Paramedical Sciences. And I must say, at this stage, we have a response time. That's after, like, once you get the call, going to the victim. So it's about, in Colombo, it's about 7.5 minutes. And in most of the centers, it's around 10 to 12 minutes. So it's again a quite achievement. So I must say we have been providing a good service with emergency medicine, and also I'm really happy that we are moving in a good direction in the pre-hospital service with the 1990 also.
Thank you, Doctor. That is important for our listeners to know. And maximum is 10 to 12 minutes.
Yes.
Across the board.
Yeah.
And then they treat the patient as best as they can at that point, get the patient into the ambulance,
Yes.
and come to the hospital.
Yes.
The whole exercise takes then thereafter about how much time?
It depends. I would say now it depends. Like if it is like if the incident is quite close to hospital, it would take about like 10-15 minutes. Like because these people are well trained of picking the patient and scooping the patient to a hospital. But if in a remote area, it might take a longer time, so maybe 30-40 minutes. It all depends on the situation
And the distance
and
to
the
the
distance.
hospital.
Yes, yeah.
As a matter of fact, doctor, we had this discussion quite some time ago on accidents and traumas over this series of programs. And one thing that happens in Sri Lanka, I don't know about your Australian experience, is where when there's an accident on the road, you find that the public, general public, well-meaning, transport the patient in any way they want to. They do not call an ambulance service that even before that was available, maybe not 1990, but whatever service was available. They don't call an ambulance, but they just lift the patient. It's well-meaning, like I said, and put the patient into any vehicle that they can pass, that is passing, maybe a car, maybe a three-wheeler, maybe a van, whatever, and transport the patient to hospital. And in the process, in trying to do something good, they cause more damage to the injury already sustained.
Yeah, I totally agree with that fact. I mean, but again, I think we all are responsible as the health professional, not providing the better understanding and making a public awareness what to do and what not to do in a road traffic accident event. So I think so it's part of our failure, which we need to address soon. And also, I think since all the listeners now remember now as I mentioned, we have a service where we can pick this patient as early as possible, unless you have it's a very long distance. And if the patient is if these road traffic accident patients are talking and well, so there are methods there are special methods that we need to transfer this patient. For example, if you have a break in your back, if you bend this patient, and then probably the patient will be ended up having lifetime not able to move their legs. So again, so if you are not aware, or if you think the patient is quite well, so get the service where the people know how to transport. That's a message I would like to pass to the listeners.
That's very important because, like I said, the Sri Lankan public, well-meaning, will go and end up doing the wrong thing that causes more damage to the injury already sustained. Doctor, now getting down to your EMTs, the emergency medical technicians who are deployed in the ambulances, what sort of training is given to them beforehand?
Yeah, so most of them underwent training in India before they started their career. Yes, because the 190, the ambulance was being funded by the Indian government, so they went to training. And now, since we have taken over, now there are differences of some of the training, so which we have modified, and so we provide 1 to 2 days training program to island wide, where they need to come to the main station in Colombo, where they will get about 8 to 10 hour training. It's again mainly the first aid and the basic things where you need to do in a case of someone dying. So that we have been providing, and we have developed a standard operating procedure where that is available in the ambulances, where for each and every entity, where if they are not sure, they can look and see and what to do. And thirdly, we provide 24 hours on-call service with our emergency trainees. So there will be 3 doctors on call. So if the EMTs have any problem, they can ring and they can ask what to do. So that's the amount of training and the facilities we have been given for these EMTs.
So there is a line of communication
Yes.
to somebody who can always advise them
Yes.
While they're on the job.
Yes.
What do I do? This is a situation. What should I do? And while transporting even the patient to the hospital.
Yeah. So there's a line of communication. We have 3 doctors per one shift. There will be 3 doctors available, and again these doctors can communicate to the receiving end also, so which can be quite useful where, say, really bad accident, so they can ring the hospital and say, for example, Karapiti Hospital, say that now the EMTs will bring this patient to hospital within 5-10 minutes. So at our end, we can be prepared to receive this patient, which again improve the quality of patient care.
Doctor, one more thing about the EMTs and in the process of transportation. In the event, it's a very very bad patient, and it's sometimes can be beyond their control to do what is even expected, even advised, I would say, from the other end.
Yeah.
But to do in such situations, how do they cope with it?
I mean, it's difficult. So now there are two systems in the pre-hospital care. So one is it's called scoop and run. Scoop and run. So you get the patient and run to hospital. So that is the method we have been deployed in Sri Lanka at this stage, because we don't have much expertise with the EMTs at this stage, which we need to improve. The second model, I would say, it's a stay and play. So where if you have enough facilities and if you have enough expertise, for example, if you go to an accident with a doctor and a well-trained person, so we can do most of the things which can prevent the person dying. So that's the model which happening in developed countries. And so for example, the center where I work in Australia, so we go there and we do best of the treatment, and then we get the patient to hospital once you make sure that the patient is not dying. But again, having said that, some of the injuries, whatever you do, they die. So these are non-preventable. So that these are, we can't do anything. So at the next stage would be in Sri Lanka. One thing is to develop the EMTs to a more recognized and more experienced set of group, like a paramedic level. And the second thing which we have been identified to develop medical retrieval system. That means you go with a doctor and maybe a nurse, or maybe the paramedic like EMT with a well experienced knowledge to the scene and providing the better care and get the patient to hospital. So those are the plans at this stage.
So hopefully they'll be developed in the years to come.
Yes.
Yes, and do you have people who are interested in getting on board to provide this service? I'm not talking about the doctors per se, say EMTs. Are
Yeah.
there enough people, young people, who might be wanting to get into this field?
Yeah, I think my experience with dealing with a lot of EMTs, most of them are really interested in this field, and they are really good at what they are learning, and then and they're quite obedient with whatever they learn. So I think the future looks really promising. So I think there will be more people coming to this field, hopefully, because it's quite satisfactory, as I mentioned in my earlier session. So it's quite satisfactory. So the people will come once they know the taste of that.
Do you have the funds to expand the ambulance service, meaning have more ambulances, or is that an issue at this point in time, financial issue at this point in time?
I think yes, but at this stage, the amount of ambulance we are having, it's good enough to maintain a good service.
So you're not actually running short in, so to speak.
No.
Right. But then you need to build up the manpower.
Yes, manpower and the expertise of the...
Obviously, that
yes,
goes hand in hand.
Yes.
Yes. So that the service can be more efficient.
Efficient, yes.
In time to come. Thank you, Doctor. So we are going on this aspect of providing the emergency service for accident victims and trauma victims. Doctor, just I want to check with you. Back to 1990. We've seen these ambulances in certain areas, and obviously some of them are in local police stations. So the call goes first to the police station or to the ambulance?
Not to the ambulance. So it's interconnected. So you get the call to the ambulance, and the response time, within 1 minute, you have to go into the ambulance and then you have to move on. So that's the policy once you get the call, and then through the connection, they will be getting the map location, the Google map, and they can direct, and the main service area that's in Rajagiri, so they can monitor all these missions.
So that system is in place?
Yes, that's in place.
Island-wide?
Yes.
Which augurs well again, because then you know where they are, what is happening, if there is somebody who is not active and can be used, deployed elsewhere, you can do that?
Yeah, so that system is well in place. So we can monitor from our main center in Rajagiriya. So we can locate each and every ambulance, where are they and where are they up to. And if we have a job in the same area, we will be deploying one other ambulance to that area. So we can do.
And this is a government
Yes.
Service that is provided?
Yeah, so it's under the health ministry now. So it's a government service. Again, it's free of charge for all the general population in Sri Lanka.
Which is why it should not be abused.
That's what I'm telling
abuse,
again
I mean,
and again
yes.
and again. Don't use 1990 for a simple fact. I mean, if you have cough and a little bit of fever, you can easily provide the public, or you can use your a transport method, but don't call 1990 for that, because you might be taking someone who's dying on the road if you use this.
Preventing that service provided to somebody who really needs
Yes,
it.
because that's right. So now we don't have a priority list. So we can't, once we get the call, it's first come, first serve basis. So so if you deployed a call to get someone to a clinic, and then if we get a call to a bad accident, and then we'll be getting ambulance from a rather distance, which can be really detrimental for the victim.
So doesn't the center monitor the call comes, they question what is it about?
I mean, we question, but the problem is at this stage now we don't have a triaging code for this. So as a rule, for the Sri Lankan rules and regulation, we can't get someone as a higher priority unless you have a triaging system. That will take some time to develop.
Thank you, Dr. Silva. Once again, time is catching up with us, and I would like to have your take-home message.
Yeah, again, I would say 3 take-home messages. So again, emergency medicine is brand new, but we are there to help you all, and we are quite receptive, and especially we do take care of a lot of trauma and road traffic accidents in Sri Lanka. So that's number 1. Number 2, now most of these accidents, unfortunately, the young and well people are dying. So make sure that we all as a nation think about this responsibility of our own responsibility to prevent this service. And number 3, now these patients, if we get this patient to a hospital in the correct time, in a correct way, so then they could easily go back to their normal life. So make sure that you use the correct path for that. So we have 1990 system in place. So if you have it, then use it. And if you think these people are quite okay, use the proper method of transport. Don't use the things which can make more damage to this patient. Thank you.
Thank you, Doctor. On that note of advice, we end this interesting discussion on road traffic accidents and trauma and the service provided by the emergency ambulance 1990, which you can call and access medical service as promptly as one could possibly provide it before the patient is transferred to hospital. Thank you very much to you, Dr. Asanka Miguelhewa, consultant in emergency medicine, and right now attached to the accident and emergency department of the teaching hospital in Karapitiya, down south in Galle, for being with us in the midst of your busy schedule, being with us in Colombo from down south in Galle to share these insights with our listeners. Thank you so much.
Thank you so much.
Really appreciate it. And my thanks go to Tarindu Disanayaka for technical assistance. I'm Fatima Razik Kader, saying good night at this point in time, and hoping to be with you next Monday, same time on Views on Health.